Diabetes is a chronic disease that occurs when the body cannot properly regulate blood sugar, also known as glucose. Glucose is the body's primary source of energy, but without enough insulin or when insulin doesn't work effectively, sugar builds up in the bloodstream instead of entering the cells. Over time, high blood sugar can damage many organs throughout the body. Every time you eat carbohydrates, your digestive system breaks them down into glucose. This sugar enters your bloodstream and provides energy for every cell in your body, including your muscles, brain, and organs. The pancreas is a small organ located behind the stomach. It produces insulin, a hormone that acts like a key, allowing glucose to move from the bloodstream into the body cells where it can be used for energy. When insulin reaches the body cells, it binds to receptors on the cell surface. This opens tiny gateways that allow glucose to enter, lowering blood sugar levels while supplying cells with energy. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, little or no insulin is produced, making insulin injections necessary for survival. Type 2 diabetes develops when the body cells become resistant to insulin. Although insulin is still produced, it no longer works effectively, causing glucose to remain in the bloodstream. As blood sugar remains elevated, excess glucose circulates throughout the body. Over time, this damages blood vessels, nerves, and vital organs, increasing the risk of serious health complications. Diabetes can affect nearly every organ in the body. It increases the risk of heart disease, stroke, kidney failure, nerve damage, vision loss, and poor wound healing if blood sugar is not properly controlled. Common symptoms include excessive thirst, frequent urination, increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing wounds, and frequent infections. These symptoms develop because the body cells are unable to use glucose efficiently. Doctors diagnose diabetes using blood tests that measure glucose levels over time. Common tests include fasting blood sugar, the HbA1c test, and the oral glucose tolerance test. Although diabetes cannot always be cured, it can often be managed successfully through healthy eating, regular physical activity, blood sugar monitoring, prescribed medications, and insulin therapy when needed. Proper management greatly reduces the risk of complications. While type 1 diabetes cannot currently be prevented, many cases of type 2 diabetes can be delayed or prevented by maintaining a healthy weight, eating a balanced diet, staying physically active, avoiding tobacco, and having regular medical checkups. Early diagnosis and proper treatment can help people with diabetes live long, healthy lives. Subscribe to this channel and follow for more educational tips about your health.